So this week's myth is that antibiotics are a cure-all for any dental infection. Antibiotics are more of a band-aid for an infection, dental infection at least. They're never going to cure it completely. They essentially will just help with the pain for a while, but eventually that infection will just come back. I have a little drawing here of a tooth. So when you get decay, initially it starts out in the outer layers of the teeth, right? So this upper just white spot or yellow on this paper is the outer layer of the tooth. This blue is the inner layer, and then this red part, that's the nerve and the blood vessels. That's the lifeline of the tooth. So initially the decay will start out in the first layer. That's this brown area here. If the decay gets past that first layer into the second layer, that's when you're going to possibly start to have some pain or symptoms. If that continues into this red nerve of the tooth, that's when it's really going to get bad. And when you have a toothache that keeps you up at night, constant pain. So once it's at this point in the middle of the tooth, that's when you're going to want to get some antibiotics. The antibiotics will help calm down that infection. Unfortunately, they can't really get fully inside of the tooth here, because if you look, the nerve in the center of the tooth is a pretty large area, but as it gets towards the bottom of the root of the tooth, and this is the entrance to the tooth right here at the bottom, this is a tiny, a tenth of a millimeter space or hole in the tooth. So the antibiotic actually cannot get inside of this. So it can help with the infection that is outside of the tooth, but it can't get inside. So therefore that infection, will eventually come back once it makes its way out of the tooth again and reinfect the tissue surrounding the roots. The more you take a certain antibiotic, the bacteria will eventually get the better of that antibiotic and create a resistance to it. We want to reduce the amount of antibiotics that we use in dentistry or in any medical field. So rather than constantly being on antibiotics for a dental infection, the best thing is to really remove the source of the infection, which would be to do a root canal. It's just like a big filling, and then you'll feel a lot better.